Hi, welcome back to Mel's Health. I'm Mel and it's always lovely to have you here with me. Today, as promised, I'm following up with a video about the CT scan. It's one of the most widely used scans to detect pulmonary embolism and the other scan that I've had experience with alongside the VQ that I spoke about in my last video. If you haven't seen that video, please go and check it out. And if you're in recovery from a blood clot, have a clotting disorder, or are suffering long-term pain and fatigue, then I highly recommend hitting that subscribe button. I'm here every week with a new video showing my experience and what I've learned along the way being in recovery from pulmonary embolism. I also like to make videos that have informative educational content about the subject so you can get some top tips of how to make your recovery better. Okay, so straight into it. What is a CT scan? It's a computerized tomography scan, usually referred to as a CT or a CAT scan. It uses computers and a rotating X-ray machine to create images of your insides. It creates cross-sectional or sliced images of the body, and it gives a lot more detail and information than just an X-ray. A CT scan can show blood vessels, soft tissue, and bone. So how does it work? It uses a narrow X-ray beam that rotates around the part of the body being scanned. This provides a series of images from all different angles. A computer then uses this information to create a cross-sectional picture. Like layering a cake, this 2D scan shows a slice or layer of the inside of your body. The process is repeated to produce a number of slices or layers. The computer stacks these scans one on top of the other to create a detailed image of your organs, bones, or blood vessels. Now, if you've seen my previous videos, you'll have noticed that when I've talked about a CT scan, I've always mentioned a CT with contrast. So what is a CT with contrast? In a CT, dense things like bone are easy to see, but in regards to those soft tissues and blood vessels, they don't show up as well and can be quite faint. So when it comes to diagnosing blood clots, for example, to help them appear clearly, a special dye known as contrast material is used. This substance blocks the X-ray so it appears white on the scan. Usually it's made up of iodine or barium sulfate. Depending on what is being scanned, you'll have the dye administered to you in one of three ways. Through all my experiences, I've always had an IV, so every time it's been injected. But if, for example, you were having your digestive tract looked at, you'd probably be asked to drink a liquid with the contrast material in it, so it would be administered orally. And if, for example, you were having your intestines looked at, then you'd probably receive it via an enema, which is where it's inserted up the rectum. So what is a CT used for? Many things. Obviously last year and this year I was having a CT for my lungs, but if you watched any of my past videos, you may have seen that in January of 2020 I was diagnosed with Bell's palsy, where half of my face was paralysed for some time, and I also had a CT around that time of diagnosis, which was on my head. So a general overview of what a CT would be used for would be to diagnose conditions like damage to bones, injuries to internal organs, problems with blood flow, stroke, or cancer. It's also used to guide further tests and treatments. So for an example, if a surgeon was going to be removing a tumour, they might order a CT scan before the operation so that they could see the tumour from all different angles and know what they were going to be operating with. Or a CT might be ordered to see a tumour before having other treatments like radiotherapy. It's also used to monitor conditions like before, during and after treatment. So if you think of my case, I had one at diagnosis and then I had one again at the 9-month stage. CTs are performed on all areas of the body from head, shoulders, chest, abdomen, the spine, your heart, your knees, and so on. So what to expect when having one done? So you'll always find CT in the radiology department of a hospital, or you'll go to a radiology clinic. It involves you laying on one of those movable table beds that slowly moves through the donut-shaped scanner machine, which is the CT. This will be where the X-rays will rotate around your body, so it's possible to hear like whirring sounds while you're in there. You'll be asked to lay very still, and depending on the part of you that's being scanned, you may be asked to hold your breath at points. For people watching this, I'm guessing you're probably getting lungs scanned if it's pulmonary embolism, so expect to have to hold your breath when prompted. This is because movement can cause the image to blur, which is what we don't want, so staying still is key. The last scan I had a few weeks ago had an automated prompter as part of the machine. So a computerized voice told me when I was in the CT, when to hold my breath and when I could breathe again. It's not for very long, I would say no more from like 3 to 5 seconds max. As I've always had the contrast dye with my scans, when I first enter the room, that's when they usually set up the IV in my arm so that the dye can be injected. The first time I ever had the dye, the nurse giving me the IV said that the contrast would be quite a strange feeling, that there shouldn't be any pain and it will be quite warm and make me feel like I'm peeing myself. And I can 100% vouch for that. She was spot on. It's a very weird, like warm feeling, and you can feel it travel across your body really, really quickly. You get a bit tingly in places. The last time I went, I really noticed that I was getting quite tingly in my like neck and throat area. Every single time I have had it, I do feel like I'm peeing myself, but it goes away really, really quickly, and I've never experienced any pain with it. So is there any preparation for a CT? Possibly. It will depend on the scan that you're having. Last time, as I was getting my chest, abdomen and pelvis scanned, I was told that I had to fast for at least 1 hour before my scan. So that meant that I couldn't eat or drink anything for at least that 1 hour before I was booked in. When I had my head scanned before, obviously that wasn't an issue. But coming on to that, you will need to remove any metal that's in the area being scanned. When I had my head scanned, I had to remove all my piercings, which can be a right old pain, especially if you're not ready for it. I have like 10 between my ears and my lip right now, so make sure you ask about that before you turn up, because I don't know about you, but it takes me like a good 10 minutes or so to get everything out. For the scan I recently had on my chest, abdomen and pelvis, obviously my piercings and everything up here could stay in because my head was never in the scanner. What I had to do though, because I'd worn jeans, was just put like a gown or like a blanket over my midsection and then just pull the jeans down to my knees so that the zipper and the button were out of sight of the scan. I'd actually forgotten about the metal part of this before I went to this scan, otherwise I would have just worn joggers or something, because they don't really need to put you into like a full medical gown to do this. They can scan you through your clothes. It's just metal they don't want to get in the way. So you should also think, if you've got piercings anywhere else, then to remove those if you're having this kind of area scanned. And ladies, if you're wearing a bra with underwire, that will also count. So either don't wear one or wear a sports bra. Lastly, this isn't so much prep, but it kind of counts. Have some water with you for afterwards if you're having the contrast dye. It can leave a slightly odd taste in your mouth, nothing that I've ever really had cause for complaint for, but the technician will tell you to drink plenty of water after the scan because it will help your kidneys flush the dye out of your system. So what are the risks? The risks associated with CT are very few. The main thing is just the radiation exposure. It is reported that around one CT scan can be anywhere from between 100 to 200 x-rays, but doctors will always weigh up the risk before ordering one or doing multiple. In many cases, not having the scan can be more harmful than the radiation exposure. The radiation as well is ionizing radiation, which we are all exposed to every single day from natural radioactive material in our surroundings. Again, one scan is said to be equivalent from anywhere between a few extra months or a few extra years of exposure to this type of natural radiation. So if your doctor thinks it's necessary to go for a scan, I would always do it. Always tell your physician if you think you may be pregnant though, because they may opt for a different type of scan to prevent any unnecessary radiation going to the child. Usually, they might change the scan to an ultrasound or an MRI depending on the problem. Lastly, as I mentioned in the VQ scan video, there is a small chance that you may have an allergic reaction to the contrast substance. If you've ever had a bad reaction with anything like that before, then please make sure that the technician is aware of this. It's not a common thing. A lot of the time people will just get itchiness or a slight rash, but there are people out there who can really suffer a bad reaction. Generally, it is very treatable, and the staff always have the equipment on hand close by to immediately treat it if a reaction does happen. Just as a last side note, I spoke about claustrophobia in my last video because you're in very close proximity to quite a large machine. Although I don't find the CT as close quarters as the VQ, if you are someone who is prone to panicking or does suffer from claustrophobia, then make sure the technician knows beforehand to try and make the process go smoothly. Generally, they've been given a lot of techniques that they can use to kind of talk you through the process and keep you calm. Once the scan is complete, a similar process will happen that happens with all scans. The images will be compiled and sent to the specialist to read them and compile a report of your results, and then they will get sent to your coordinating doctor to give you the feedback and the results. And that's the CT in a nutshell. I hope you found it easy to understand and quite helpful, especially if you've never been for one or you're booked in for your first one soon and you don't know what to expect. Please give this video a like if you learned anything today, and whilst you're there, I'd be ever so happy if you could hit subscribe at the same time to continue following me for more weekly content as I continue through this recovery process. Let me know in the comments what you might possibly want to see me talk about in the future. I was given some results yesterday of all my latest tests at my 9-month review, so I'll be doing my next video all around that to give you guys some updates on what's going on with me. So please look out for that coming very soon. And as always, I thank you very, very much for watching, and I'll see you soon. Bye.